welcome back to the Wellness and Growth Journeys podcast, where we dive deep into the stories of health and wellness leaders making a difference. I am your host, Mia Lisa Garnes, the founder of the Wellness Growth Agency, dedicated to empowering women centered health and wellness businesses. Now, today we have the pleasure of welcoming Dr. Anike Serrano. Hopefully, I got that.
You sure did. Perfectly correct. And thank you for that welcome and thanks for having me.
Yes. No, Dr. Serrano, you are the clinic director at Harley Street Clinic in Barbados. And this clinic brings a unique blend of medical expertise and a passion for holistic healthcare, right? And you were trained at the American University of Barbados and Harvard Medical School, and you specialize in both aesthetic treatments and preventative medicine, dedicated to improving healthcare accessibility and equality in your community. So, welcome again. Um, Dr. Serrano, can you share with us? Well, there are a lot that we can get into today because I need you to clarify what Harley Street Clinic does, because we did have a prelim conversation and you did say, well, no, we're not just aesthetic. We are holistic. We deal with holistic healthcare, right? And then I guess I really want to get your background or your story of your journey into medicine and really what inspired you to specialize right in aesthetic medicine along with infectious diseases. Like, did I?
It's a very weird combination, but I will explain and then it will make lots of sense after I do
All
explain.
ears, all ears.
Okay. So what got me into medicine in general was it kind of was instinctual for me or instinctive. My mom is a nurse and my father is a pharmacist. And when I was a lot younger, I would I don't want to say be babysat, but after school, I would go with my mom. She worked in a public urgent care facility. Even before that, my mom was a pediatric nurse at the Queen Elizabeth Hospital. And during my summer vacations, instead of going to camp, I went to the peds ward with my mom. So all my friends were patients on the ward. We played Barbies together and tie-dye shirts and all that fun stuff. So I was kind of in the world of medicine from the inception, or from the time where children are normally kind of figuring out who they are and building their personalities. And medicine hit me so young that it really was the only pathway that I ever thought that I would be good at, and two, the only thing that I ever saw myself being a part of. Now, the part that my father was also a pharmacist, I was just enveloped in medicine from all aspects. So from the time you're seeing a nurse and they're caring for you, the doctor is making decisions and actually going and doing procedures, I was there watching all that. And then from, after that happens and you feel a little better, you go to the pharmacist. Then I was actually very young, the one counting the little tablets and explaining how to take your over-the-counter medication at the age of, but I won't say it here, but at a too young age, too young of an age. But that's what brought me into medicine. Infectious diseases kind of was a happy accident. And when I studied, I did my clinical rotations in Atlanta, Georgia, United States. And so in medicine, you get to choose electives, and electives are your choice, what you want to kind of do for maybe the next month or 3 months or so. And I chose infectious diseases just because it was close to where I was living. I did not have an interest in infectious diseases. It was just convenient for me.
Okay.
And I honestly fell in love. And what I fell in love with were the patients. The types of diseases that we were dealing with or treating and managing at the time were things like hepatitis, chronic hepatitis, HIV, illnesses as well. And just seeing the difference in, I don't want to say the difference in care, but the difference in patient outlook between what I came from, which was Barbados, and these patients who were diagnosed with HIV in Atlanta, Georgia, they had such a positive, it was almost so unexpected. They had such a positive overview of life.
Like a death
It
sentence.
wasn't. It absolutely wasn't. And that was because they were undetectable, meaning they can't transmit it to anybody else. They were living their lives. They were healthy. They were actively going through treatment and very happily so. and there was no stigma associated with it, at least in the clinic that I worked in. They were outwardly saying, yes, like somebody with an accent, first of all, young person, don't know who I am, but they were so happy to share their stories and not feel embarrassed or not feel have that vulnerability about them. And I just was like, I want to take this and put it in Barbados. Like, I want this feeling to be for everyone who is in Barbados dealing with what used to be such a horrible disease. I say it's not horrible anymore because of the advancements in medicine that, you can live with such an illness. But at that time, I was like, I wish that we as Barbadians also had that outlook on something so daunting and something that was previously, like you said, a death sentence, but it no longer was. And that really made me feel very purposeful and very fulfilled. And that's where my love or passion for infectious disease stemmed. Now, aesthetic medicine was another happy accident. Well, an unwelcome challenge, I will say that.
On welcomes.
And a welcome challenge.
A welcome
So,
challenge.
yes.
Hmm.
So I applied for a position at a new clinic, which happens to be the Harley Street Clinic, as their full-time physician. And I was thinking being their general practitioner with also my specialty in infectious diseases, or my knowledge, I should say, in infectious disease. But then I realized, okay, this is a new clinic. I wasn't sure what they were all about at the time, but then they said, oh, they're aesthetics. And I knew all about aesthetics because my best friend, who I work with now, she wanted to be a dermatologist and an esthetician, like an aesthetic doctor. So she was very passionate about it, and she shared those passions with me. Similarly, like how I would share my passions with infectious disease. So we kind of built a mutual respect for each other with that. And then I was, given the opportunity to work here as the lead physician. But then at my last interview to get this position, they said, okay, we would like you to do aesthetics, but besides that, we would like you to be the director of the clinic. And I said, okay, that's a challenge, but I am ready for it. Yes. So that's how aesthetics came about.
So what's the difference? Do you find the differences between the two, infectious diseases and aesthetics, and or similarities between the two fields?
So the similarities in all parts of medicine is there are patients who are trusting you. They're worried, they are scared, they are vulnerable, they want help, and they're trusting you with the knowledge that that you have in your brain, essentially, that you studied all these years and to do. They're coming and they're trusting that you're the authority in whatever their issue is. And they're hoping that by the time they leave, they either feel better or there's a plan to make them feel better. So no matter what area in medicine, that is always a similarity. The difference is the difference I would say is with patients who are dealing with these chronic illnesses, there was always this you're trying to build them up and trying to make them feel empowered and trying to make them feel well educated enough to feel empowered and to feel as if they are like everybody else, and there's no innate difference within them. We're all human beings, and this disease that you have does not make you who you are. So that was
Right.
always a struggle. That struggle can take a toll, of course, on the patients, but on their overall support system, whether that be the family members or the providers that are helping them. With aesthetics, it's a little different. With
Right.
aesthetics, usually the patient comes in knowing exactly what they want. So there isn't really that innate fear that is associated with coming to the doctor. There might be a little
Right.
fear here and there because if you think about needles and such,
Yes.
then yes,
Especially me. No.
exactly. But it's all elective. You choose to come in for aesthetics.
Right.
Whereas
Right.
with the chronic illnesses that I was dealing with previously, um, they didn't really have a choice.
Yeah.
They needed help. So that
True.
was the
True.
difference. The
True.
similarity I would say is the trust that my patients instill in me. There's still the trust across the board.
For aesthetics, though, I feel like yes is optional, but we just want to feel and look better. just just want to feel and look better. So it's interesting because it's only in recent times do I feel that women now are coming forward to go to do aesthetic treatments, because anything with aesthetics and treatments, we would just the most would be a spa, like a
Nice
facial and that kind of
massage,
nice massage. That's what we we would do normally. But no, there are more treatment options now that are coming out, where you could look and feel your best all the time. You don't have to wait until like a special spa day to go and, get like your facial just done and that kind of thing. So I'm liking that women now are coming forward now and really seeking like these more, I guess, more um,
Kind of like an escalation of what they're used to doing.
yes. So just like how I will go and get my nails done every month and, like go and get my hair done. No, we could add this now to our kind of routine, our self-care routine, which I think is really good. So as the clinic director at Harley Street, then what are your main responsibilities? And then how do you ensure that the clinic addresses the holistic needs of your patients?
Sure. So, as the director of the clinic, I basically oversee all the operations here, whether that is in terms of human resources, like the employees that we have here, inventory, but most importantly, about setting the ethos of the clinic and what we stand for, what we hope to accomplish, both on a larger scale with our community and then also individually with our patients. So, one thing that I always tell my colleagues here, we normally have like a monthly or weekly meeting just to make sure we're all on the same page and things like that. And I love communication. So I think that's really important. But one thing that we always say in our meetings is there are three things that we really want to focus on. One is confidentiality. Even if we were not a medical clinic, I think that person's coming in trusting you with their information and their vulnerable moments. It's really important that they feel that they can trust you. And that's the only really way that you can build that trust and build that rapport so that they can feel comfortable discussing things that they may not typically want to discuss. The other thing is respect for all persons and making sure that everyone feels respected, no matter what walk of life they are from. Everyone that enters the Hardy Street Clinic, I want them to feel like they are the most important person in the world. How we do that is by really I would say scattering for lack of a better word, or appointment. So when you come in, you have everybody's attention. So all eyes are on you. You feel welcome because you come to the doctor. If you're coming for aesthetics or you're coming to the general practitioner, then you're so nervous. There's a level of anxiety. So if we are all super friendly, they're not kind of strangers sitting in the waiting room watching you, like what is she doing? What's she here for? Then
It's true.
it eases a lot of that
It
pressure
does. It
and it
does.
makes people feel really a lot more comfortable. And the third thing that I talk about is education, because I think that it's very easy to say, okay, I'll write this prescription, take this medication, or
Right.
here are these skincare products, do it in this order. But it's really important to explain and to educate persons on their health and why they're
Agreed.
doing the things that they need to do, because it
Agreed.
then creates this more personal relationship with whatever treatment plan you're about to get. And it makes you want to do it because you know
Yes.
why you're doing it.
Yes.
So I mean, our consultations are not hours long, but we always educate. We're always in there just saying, this is why we're doing this, and this is how the skin changes, and this is how the body changes, and this is why we need to have pap smears, and this is why we need to have mammograms, and things like that. Another thing
Right.
that's really important is in each of the consultation, you may just be coming in for a medical grade facial, but we want to know everything about you. So we want to know your past medical history, what medications you're taking, if you're a female, when's the last time you had your pap smear, your mammogram? Because even though you're coming in for one thing, sometimes you may think about the changes that you see in front of you. You look in the mirror,
Right.
you can see that. But there are internal changes that are also happening when we age, and it's a lot less. You're not able to kind of articulate those changes, or maybe you don't even know about those changes. So the education from there is important because we don't want to miss anything. Yes, you're coming for something where it seems skin deep, but we're not treating just dullness on your skin. We need to go inside and find out,
Yes.
okay, why is the skin looking dull? What's happening? Are you deficient in anything? Are you hydrating yourself? Are there any stressors at work? What's your lifestyle like? What medications are you taking? Were you ever hospitalized? For what reason? So these are all connected, and that's why we
Yes.
like to do. So that's how we do more of a holistic approach
I
by
was
not
just
just
gonna
looking.
say, yeah,
Yeah,
this is
so
the
we don't just
holistic
look
here.
exactly. We're not
Right.
only just looking at what you came in for, we don't do it in a way where it's overwhelming, like we're bombarding you with questions. But it's a conversation. We're getting to know each other, we're getting to know you. And then from there, the best recommendations can be made. So we're not just ticking one box and we have a list of other issues that we really need to deal with.
You know what stood out to me and that I like, and somebody listening, anybody listening to this would be like, really, that's what stood out to you. I like appointments. Full stop. I I I am at the stage in my life where if you don't stick to appointments, you lost me. You lost me. I mean, going to see a doctor, like you say, you're nervous, and then you got these people around you and that kind of stuff. And then on top of that, you there for 2, 3 hours, and they're like, "Well, hello. I'm pretty sure you told me to
And
come
the
in."
nerves building up, and you're like, oh, what could this be? And it's a lot of pressure that you don't need.
Exactly, exactly. So I do like that. And then when you were describing it, then the Cheers team song come in my head. It's probably
Oh,
gonna age me, but whatever.
no, I love Cheers. I used to love Cheers.
Right? Because yeah, I do like that kind of sense of community when it comes to the people that you go to. So again, the people you go to get your nails done, your hair done, that kind of thing. You want to have that kind of rapport with what I would call them, I guess, service providers or your
Yeah, yeah, yeah,
you want to kind of
essentially.
have that rapport. So there's often a stigma around aesthetic treatments. Now, how do you address these misconceptions, particularly among women over 35 and in the Caribbean? Obviously, I guess maybe Barbados. You could speak about us because um, there are a lot. Well, there's a lot of stigma. One, too expensive. The next one is that it is not for me, right? It's not for my kind of skin type, right? And then three, like this kind of fakeness that might go on, um, you know, with Botox and like when you think aesthetics, you think Botox and my lips can look fake, and so I might be missing more, but those are the three for me. The cost, people thinking that well, once you do aesthetic treatments, like you want to be fake or you don't want to, you want to do some sort of celebrity stuff, and and then three, it might not be for us, our skin type. So how do you address those? I guess.
That's a really very good question. I think what happens too is because people in Barbados or people in the Caribbean, we are usually very spiritually inclined or very religious, and we always have more of a religious center. So sometimes we think that it's vain to do these things for ourselves. So sometimes people may think that it's vain to take the time out and do something that seems silly or not important. But I think that once you let persons know when people do come in for these treatments, you let them know it's more about empowerment, one, and two, it is also about the ability to make persons look natural. So the unnatural look I find is more of the Western kind of idea of beauty, and we have a different standard here, and especially a different standard here in the clinic. The most complimentary thing a patient can come to me is when they come back to the review and they say, doctor, nobody knows what I did, but it just say I look more refreshed. Like I just look like I had a really nice vacation.
Ooh,
And to
yes.
me, that is the best compliment ever. To me, that is where I feel like, okay, I did a very good job there. But in addition to that, the price. So yes, again, these are elective treatments. So usually some of the treatments here, they might be a little top of the line. Most
Right.
of our
But you
most
want
of
the
our
best.
equipment, you want the
You want,
best.
yeah,
Most of our
right.
equipment here is state of the art, but it doesn't necessarily relate to prices. So our prices are very competitive based on markets here, both in the Caribbean, and
Nice.
also in the UK and in the US. So we did a
Well,
lot of
that's good to
research to
hear.
make sure that we aren't, gouging persons and that everybody can afford something. And there's
Right.
also different treatments depending on what your budget is. It doesn't mean that one is less effective than the other, but it just means that this may work for you a little better and it just also happens to be a little less expensive. So
Right.
so that's why we have so many different pieces of equipment so many different types of, let's say, medications, if we're going to talk about Botox or fillers, that we can use with persons that might be a little bit more affordable. And then the point that we also prefer a more natural approach, then you're essentially doing less, so you're using less. So it usually costs less.
So do you guys do like a custom type, I guess, treatment when it comes to the aesthetic treatments that you guys offer?
So everyone that comes in, of course, like I said, especially with aesthetics, they have an idea of what they want. And I love that. So you come in and you book an appointment for, let's say you're having laser or Botox. Let's say you're having Botox. So you come in and you say, I would like Botox all over my face. And you have an
Right.
expectation that you're going to get Botox all over your face. But of course, there's a consultation that happens before. And usually we kind of say, okay, make different recommendations. Well, you don't actually need it all over your face. You may just need something topical as well to manage or to treat the very, very fine wrinkles that you have. And maybe a little bit of Botox would be helpful in certain areas. So while everyone does have an idea of what they want, our consultations kind of allows us to gear persons in the best treatment for them. And each consultation is completely different. It's not really like a cookie cutter because everybody is very different. The way that we articulate ourselves is very different. So there's some persons that speak very animated, or very expressive, and they may have different concerns to someone who has a more stoic type of appearance and isn't really forming the wrinkles and the lines in a way that someone who's more animated like. Or someone may say, well, I like my animation. I love people to be able to see what's happening with me and how I'm expressing myself.
Right. Because the Botox stop you from moving in certain.
Yes, it can. So that's
Okay.
what
Okay.
that's what the medication does. We don't do that here though. We don't stop people from moving. We don't freeze faces, but that's what Botox can do.
Right. Right.
Yes.
Because that's the other thing that you think
Yes,
about Botox. Because and then we make fun of it,
we
right? Like,
do.
oh, like look, she can't smile. Look, she
And then
can't laugh.
instantly they have something. Something was
Yeah, yeah.
done.
They do something to their face,
Yes. So we don't
and
want
it
that.
comes like a negative,
And it
as
becomes a
opposed
negative.
to, yeah, as opposed to something positive, which is,
Yes.
yeah.
And we love to take the approach that less is more. So we always start with our consultation, then we actually perform the procedure, but then there is a review or a follow up. And that review and follow up, which is usually free of cost here at the clinic, and that's because we want persons to come back. We don't want you to feel as if, oh, every time I walk into Harley Street, I gotta pull out my wallet. No, that's not that's not really what we are trying to accomplish. That's not what we're trying to accomplish, but we encourage that you come back because
Right,
if you take a less is more approach, you can kind of build on something. It's much more difficult to take away. I've always heard this growing up. It's easier to add than to take out.
right, right. So well, I guess back to one of the misconceptions or stigmas that we mentioned. Are there any specific things that women of color should be aware of or concerned about when they're looking to get any aesthetic treatments done? Does our skin complexion at all? You know what I mean?
Yes. So it
Okay.
definitely does. So we are different in the way that we have different type of melanin. So our melanin presents in this beautiful brown color. There are many different shades, but it's all brown, ranging from lighter to darker complexions or what we call Fitzpatrick's. And usually because yes, so Fitzpatrick's is the way that persons in aesthetics kind of categorize different shades. It's a lot easier for us to understand, what we want to do and what the outcomes will be if there's a way to categorize persons.
Fitzpatrick's.
Yes,
Like the
Fitzpatrick.
last name? Fitzpatrick.
Yeah, like the last name. Yeah,
So those are
exactly like the
different
last name.
shades. Like
So those
each
are
letter is
different
a different.
shades. Each number is a different shade. So someone, for instance, that's a Fitzpatrick one would be very fair, normally European descent, blue eyes, blonde hair, maybe have freckles. Whereas someone who is a higher Fitzpatrick, like Fitzpatrick 4, 5, or 6, they're usually of African descent, beautifully melanated. So yes, so that's a way for us to describe person's skin color, skin tone.
Okay. All right. Okay.
What
Yes.
happens? Yes.
Hmm.
What happens with persons who are Fitzpatrick's, maybe around 4 to 6, is because of that melanin, it can become very reactive if we do something that has a lot of energy in it. Let's say we're going with laser, or even if you do something like a chemical peel. Those melanocytes, or these cells that produce the melanin, become activated. And then because of that, it can create scarring. So it's really important that if you're ever doing any treatments that are putting any type of energy or can cause any type of irritation on the skin for someone who is medium to darker complexions, that your provider is educating you on that and also prepping your skin for that. Because there's a lot more that has to happen before you actually have the procedure so that you can have a safe and effective outcome. And that's what we always want. We always want safe, but we always want effective. So there's a fine line there where we're not doing too much and also taking into consideration that everybody is not, everyone is not the same.
Are there any other, I guess, precautions or maybe questions that women of color can ask their aesthetic provider, when it comes to treatments um, for their particular skin? Because I did have a conversation with a aesthetic doctor, and she was saying that when it comes to laser therapy, um, or some of the equipment that you use, like it should be specific to black skin, or to make sure that is specific to black skin.
So definitely, I think for anyone who is darker complexion or medium to tan or darker complexion, you need to first make sure that one, not only the equipment can handle your skin type or it can be safe and effective on your skin tone, but that your provider was also trained in order to use the machine or to use the products with someone of your skin tone. And what we do here is we make sure that every time we work with a new vendor or a new supplier, we ask that very specific question. And we also request persons of color to train us because it's very difficult to understand our issues if you're not of us, because you may not have that experience. And it's not that that you don't want to know, but there are things that we deal with as women of color that we just cannot articulate or explain. We just know it just happens to us. So it's important to make sure that one, they're trained to handle skin of color, and also that the machine was also made for that. Because there are some machines, for instance, we have the Candela Gentle Max Pro Plus. Now, the Candela is a wonderful brand which has been around for over 40, 50 years, I believe. But their earlier models cannot touch persons with skin of color.
Would
It will
it
cause
burn, or?
it will burn and
Wow.
it will scar.
Yeah.
But the model that we have specifically was made to handle all skin types from the lightest to the darkest. Now, not all procedures or all treatments we can do on darker skin types without, even with or without prepping, but there's always an alternative. So we will have, it may not be laser that you're using. Let's say you're coming in because you have acne scarring. Someone who's a Fitzpatrick 1, who is a fair complexion, yes, they can use our laser for acne scars, but someone who's a darker on the skin tone scale, they may have to use a different approach, which might involve things like chemical peels or topical treatments. And even if we do use a chemical peel, it still involves at least a 4 to 6 week period of you prepping your skin and what we call quieting your melanocytes, or putting those pigment cells to sleep for a little bit, so that if anything does irritate the skin, they're not awake to react. They're sleeping
Okay.
through the whole process. And then when we need to, then we can go up and kind of stimulate them again. But it's the safest way to do it. So 2 questions you want to ask, well, 3 questions you always want to ask your provider is: one, is this safe? Will this be safe and effective on my skin type? Two, is this machine or product specifically made for my skin type? And you want to see evidence. You want to
Right.
see whether it be before and after pictures or studies that were done to
Right.
to kind of make the claim that they're saying be substantial. And the last thing is, does my skin need any prep? And what do I have to do after I have this done? And it's specifically with the before and after prep or the aftercare, you want to make sure that you can afford the time that is associated with it. Because we can tell you what to do and educate you on the risk of not doing it, but then life happens. And you want to make sure that you have that opportunity to really follow the appropriate steps both before and after.
That's really important because I find that for me, if I was going to look up somebody to do some sort of procedure and you advertise that you do said procedure, then I'm going to go and I'm trusting you, that you know what you're doing. So now, thinking that, well, let me make sure that I ask these questions, right? To make sure that yes, they don't burn my skin or they don't make it worse. But that's it's good to know that um you could ask these questions just to find out before you make it's your skin, it's your face, wherever you're getting the treatment done. So you really should do your due diligence and make sure you do your research on who you choose to do certain procedures with you. So thank you for explaining that for us. um, so, given the restrictions on promoting medical services directly, right, especially in Barbados, how do you navigate marketing the holistic services at Harley Street?
That's a really good question. It's also been very challenging to kind of traverse that world. But what we do here is when we show our personalities, we show the providers here, so that you feel comfortable and you can kind of trust us and feel that we're reliable sources of information. The other thing is educate. So we like to put tips on our Instagram. We like to show different ways that you can. No, we don't really do before and after pictures just for patient confidentiality, but that's like one of the most things that we take very, very seriously here. Even if that means someone has to come in for a consultation so that you can see pictures. I just don't feel comfortable putting persons, and that could change. I mean, you can't really always say I will never, but at this point,
Or there could be a way where you could hide the identity, even though I think I heard recently that Meta is gonna try to crack down on these before and after shots a little bit, because I know for a fact you can't advertise using these before and after shots. um, but yes, we do, and that's something else, right? If you watch any of those videos on Instagram or even YouTube with the plastic surgery, I mean, that to me, that's you selling it right there. So to remove the before and after, I'm like,
yeah, that
well,
takes away. You really have to do a lot more work. You have to build trust. Yeah, you really have to build trust. And that's what we really focus on here. Another way that we do it is by educating or building informative posts, talk about prostate health. We talk about medication compliance. Spoken about pap smears as well, and we use the entire team so that if my voice doesn't resonate with you and you can't relate to me, you might be able to relate to our wonderful nurse, Nurse Thorne, or you might be able to relate to Shara, our head esthetician. So we use different voices and different faces to kind of sell the same message or to promote the same message. Um, that's really how we get around, and then we can advertise or promote the other things. So we can promote products, we can promote things like skin consultations, laser treatments, but it's specific to different medications that we can't really sell on Instagram in that way.
okay, that is all right. So from your extensive experience, then, how significant, um, right, in when it comes to lifestyle, how significant is diet, right? And yeah, and I guess lifestyle in maintaining your skin health, especially for women over 35. How significant is that? We could talk about, and I feel like I know, like, you know the basics. So you gotta hydrate, you gotta moisturize, um, and clean, moisturize, hydrate. Is there anything that's missing outside of that we should do?
With stress, Women over 30. I mean, I'm soon getting there. I'm 33. I feel like I'm 35, but I'm 33, so I'm soon there. And I'm very grateful to be soon there. But it's stress. Stress really takes a toll on the body. And it's again those types of triggers and that insult on the body that we cannot, that's not tangible, that sometimes we ignore. But it's so important to figure out kind of what your stressors are and not kind of build things up. And as women, especially as Caribbean women, we have to put on this strong front. We have to be nurturers, but still strong, be supportive, but still protective. It's a lot of hats that we have to wear, and they all contradict each other. So it's very difficult to do that for anybody, even the most well put together person. It's they have stressors in their life that they don't necessarily, they may not be able to deal with, or they may not even notice that it is stressful. And so I think in addition to the hydration, consistency is another one, being very consistent with whatever you are doing, whether it's an exercise program or diet. When I say diet, I don't mean cutting out certain things. I just mean having a healthy, balanced diet. Um,
Right.
Taking
Right.
your multivitamins. With everything, there's consistency. So being consistent in good habits is the number one thing. And then number two is identifying what your stressors are and being able, finding ways to cope with it, whether
Right.
it be taking yourself away from a situation, finding support, whether it be your husband, your best friend, colleagues at work, or even a therapist or a counselor, but being able to cope with those stressors so it isn't building up in our body and affecting our cardiovascular health and how we interact with people and decisions that we make. Because
Right.
if you're stressed, you kind of react, or you live in a fight or flight type of experience, and that's never
That's
good.
true, right?
Some
That's
people do it
true.
for so long that it's just their normal, and then you don't even realize that it's happening. But I think if I were to say the biggest one, it's dealing with stress. It's finding healthy ways to manage stress.
Interesting. I well, I didn't even think about that when it comes to skincare.
Yes, yes,
And I
definitely.
suppose how does then stress specifically kind of manifest on the skin or I guess in the body? If you could share that, like
Sure.
how does it come to? I mean, I suppose it probably could affect any and everything,
It
but
can. It sure can. So one, your cardiovascular health. It can increase your blood pressure. There are ways that we can deal with stress without knowing that we're dealing with stress, which could be comfort eating, which can increase your BMI, put you at risk for certain cardiovascular effects. Obesity has a long list of consequences,
right,
and that can stem from just trying to deal with stress in an unhealthy way.
right,
um,
right,
Eating the wrong things as well, and that comfort eating can directly affect our skin as well. Persons who have high blood sugar, it's always manifested in the way that their skin appears because the sugar needs to go somewhere. It goes in our brains, it goes in our eyes, it goes on our skin, it goes in our kidneys, and when that builds up, it destroys our bodies. So it's really important that we eat healthy for that reason, but two, that we find better ways to cope with stress. And the
right.
reason why the reason why I gravitated towards that comfort eating is because I found myself guilty of it when
Okay,
I and
okay,
I didn't even realize that that's what it was. So when I had my only child, my son, during my pregnancy, I was very healthy. So, well, very healthy. I exercise. I used to go for walks every morning. I would have this perfect little diet that I kept to. But then after my son came, I don't want to use the word traumatized is a strong word, but I was shocked into what motherhood was. And I was like, I have
okay.
no time for myself. And I would prepare these wonderful pureed meals for my son, but then I would eat whatever was there because
Yeah,
it was a lot. I was always tired. I always
right.
wanted to be the best mom, the best fiance, the best daughter. And I kind of
Mm-hmm.
put my priorities changed. Before I was like the center of my universe. Sorry, it didn't to sound self-centered, but when you're much younger, that's kind of all you have to take care of is
Yeah.
kind of yourself.
Yes.
Yeah. So that's
Yes.
what I was doing. And
Yeah.
I was doing it wonderfully for 26 years. And then my son came, and my husband came, and my career came. And then that I became the last thing I ever thought about. And whatever was easiest for me was what I ate, was what I did. I stopped exercising. I had stressors, but I would kind of keep it all inside, and it just manifested in me gaining a significant amount of weight. And so I speak from experience when I say you don't realize that you are kind of treating yourself when you're stressed. It just seems like a norm because even as we do it every day, at least 3 times a day, right? So it doesn't seem like something bad.
And in
It just
between.
seems
Hmm.
like that exactly. It just seems like something you have to do. But it can take an unhealthy kind of turn. And it happened to me very easily without me even noticing.
I wow. So your story sounds similar, similar. Yeah, like it. Yeah, I am. For me, yeah, I went to the bottom of the barrel, already bought at the bottom of the list, like you say, when it comes, and it went so far that I then started to wonder, like, who am I? Like, it's no, it's like, who am I now, right? Um, and like you say, it could be quite jarring. It could be quite jarring, and you don't know until you've experienced it. And because, like you say, before you have ideas of how your life would go and how you want it to go, and then baby gets here, and all of this just goes through the window. And then, like you say, you're sleep deprived and you're tired, and you're trying to maintain a relationship with your husband, trying to spend, make sure that baby's okay. Then you also have your career, and then your self care time or you just goes to the back burner. So no, even things that used to bring you joy before, one, you don't have time to do it anymore, and then two, maybe if you sit down, you're like, right, but I don't like doing this anymore for whatever reason.
It
So now, like,
almost seems like you're forcing yourself to do the things you used to like to do. I'm like, why am I doing this? But you kind of should force yourself and you should do that. And it's really important to have that support system because I did have that. And I'm very lucky that I did have that. So I had friends that would continuously call and be like, we haven't been out for months. Where are you? Let's do this. And I would be like, no, I don't want to go. But then they would show up. They would just be like, get dressed, bring the baby. We are going.
I like
So
them.
yeah, so you always need to have a good support as well, I would say. But it's so common the way that I describe it, and then you kind of said, well, that happened to me too. It's too common that people, and it's scary that we don't know it's going to happen. It's so common that we should be able to expect it, but we don't talk about it. We don't share that information with our friends that are pregnant about to have babies because we don't want to traumatize them. And then we also think, oh, that was only me. It won't happen to her. Or it won't happen to that person because they have such a wonderful life or, they have the support. So it won't happen to them.
Yeah.
Yeah, exactly.
It's far too often, and maybe to everybody, and you really gotta check in, like, hey, look, check in on your girlfriends, especially those who just had a baby. Do some, yeah, check in on them, because
And like my friends did, just show up.
um I don't know if you saw the episode that I had with Leslie, where she was talking about postpartum depression after she had her second child. And she had support. But she was just overwhelmed by it all. Um, and it seems like it is a thing that is very drastic for women. It seems a
It's
thing
like,
where,
what is this? Why am I here? And the funny thing is, sometimes you don't even know that you're going through it until you've gotten to the other side, until you've gotten back to your baseline. And you're like, wait, what just happened?
yeah, and what's funny, and this is probably popular opinion. I would watch, like, people who really want to have kids, and and the Matt D show and everything, and I'm like, if you only know what you in for at this
This bundle
point.
of joy is about to change your entire life.
I think for me, the first couple of, maybe the first day when we brought him home, And I was just looking at him. He looked so peaceful when he's sleeping and looked so cute and everything. And then refused to sleep at night for like the next week. And I was like, this is crazy. And then sleeping like a log during the day. Oh, that was something, boy. That was a whole. I don't think you could ever be prepared for that.
No, and I always tell patients sleep when baby is sleeping. But when baby is sleeping, when you have to cook and clean, go to work, then it's prepare for the next day, then it's not possible. And I almost feel like a hypocrite telling people that, but it's the best way that I can articulate, trying to tell them sleep whenever you can. That's, yeah.
Yes, yes. And then you were in recovery too, like that first couple of weeks, right? You're trying to recover. You're doing well. If you did vaginal birth, you're doing your sitz bath, and then you gotta try to eat and right. Then you gotta try to eat because you gotta keep your milk supply, and then you got the issues with your breastfeeding. In the initial stages until like your milk comes in, and then you want to keep your milk supply up, and then you're tracking like the times that baby needs to be fed, and it's a
It's
whole
a
thing.
whole, it is. It's like having three jobs in one. It's a lot.
But in your experience though, what are some essential health maintenance strategies that women over 35 should consider to enhance their overall well-being? So we talked about stress, and what we could do to help eliminate um, the stress, seeking help and talking to friends, or maybe getting therapy, perhaps even exercising and watching your diet, that kind of thing. But what, in terms of maintenance now, like health maintenance strategies, what are some things that, you know, you would recommend for women?
So I would always say go to your doctor, even if you're not ill. There are certain protocols and screening and preventative screening checks that we have to really abide by. Usually it happens every year, sometimes it's every 3 or 4 years, but you need to build that relationship with your doctor so that you can have that checklist, because it might be the last thing in our mind, but your doctor is there to make sure that it becomes the first thing on your mind, that you do what you're supposed to do, whether that be breast cancer screening or cervical cancer screening, colon colorectal cancer screening. So those ones are very, very important. I would say one, be build a relationship with your general practitioner, or find a general practitioner or family doctor and go at least every year. I would say that's number one. Number two is, again, stress. So finding ways to cope with stress, maybe finding new hobbies, finding a great support team is also a very good one. Um, yeah, that's what I would say. So one, building a relationship with your doctor. And why that's important too is so that you can establish those baselines, because you never really know what is wrong for you. Everybody's completely different. Everyone, I see patients and I look at them as individual people, but not really as symptoms or like tests when I do run tests.
Which is
Everyone is
good.
very different. What may be good for person A is normal for person B and has been that way for many, many years. So I know not to overreact or panic if I see something. But if I don't know you, then it becomes very difficult to kind of establish what is good and what is not bad. Yes, there are ranges, international ranges that you go by, but again, like I said, everybody's different. Some people may be on the lower end of normal, on the higher end of normal, and that's normal for them. So if you see these subtle discrepancies or subtle changes, then you will be able to take appropriate action quickly, or quicker than if you wait until something actually manifests. You actually have symptoms for something, you go to the doctor, and then you don't really know what the baseline was to start with.
I agree with that. Are there any particular tests that you recommend women? Because when you're younger, you're really doing the tests. But are there like specific tests you think, hey, look, you're over 35 or you're over 40. Hey, no, it's time to, because I know mammogram is one for when you turn 40. I've been seeing recently people saying getting a colonoscopy done, and are there any others that you say, hey, look, this is your age, it's time to get these tests done?
Yes, I would always recommend persons have vitamin testing as well. And why that is because we're in a pretty resourceful country, so we aren't really, you may think that what you are eating or what you're exposed to is sufficient, but you would be surprised that when you get to a certain age, the absorption of some of these vitamins and minerals that we actually need in the body, like magnesium and calcium and vitamin D specifically, which is so crazy because this is where we live. But I have so many patients who have come in with these very non-specific symptoms, and we check their vitamin D and it's actually really low. But persons of color, specifically persons of African descent or Caribbean persons, we have a problem with absorbing vitamin D. And so usually it is a little low, but we need to see what your low is. So what is normal for you so that we can start treating. And once you do get those vitamins back in check, so you can do things like IV therapies, you can take oral
Right,
vitamins,
right,
you can change your diet plan and make sure that you're getting an adequate amount of vitamins in the way that even the way you prepare your food. So some people, you may think you're getting lots of iron from spinach,
right.
but if you cook it in a
Popeye.
certain way, you cook out all the iron. You're just sitting
Right.
down there eating spinach for no reason. So you need to, yeah,
And
you need,
spinach is my favorite.
and then of course the amount that you're eating. So
Right.
it's better to do those types of testing. If I had to add things onto that list, so mammograms, pap smears is also a very big one.
Mm-hmm.
The colorectal screening, so colonoscopy. There's also blood tests that you can do to
Right.
check to see if you have the genes that put you at risk for colorectal cancer. Another
Okay.
one is the thyroid levels. I always recommend thyroid checks for persons, especially persons who feel a little tired, or who are gaining weight or losing weight and they can't really explain why. Then I always recommend thyroid checks. HbA1c is another brilliant one that I think everyone should do as well, just because we are, our population in particular, we have a high risk of diabetes, and that's just culturally what our habits are. We
Right.
choose foods that are a little sweeter just because that's our palate. We've been brought up that way, and that puts us at risk for things like diabetes. And diabetes in the early stages, you don't typically know. You just have these, again, very non-specific symptoms. Before it gets out of hand, it's usually very non-specific. So
Right.
HbA1c is the test that diagnoses for diabetes. It gives us a better indication of what your sugar management has been for a longer period of time than just the finger stick test. Another one is your cholesterol. So all these internal things that you might not be able to feel or see or tell if something is wrong, those tests are really important to do on a regular basis. So when I say regular, once everything is normal, I would say every year. If there's something that you're trending or tracking, let's say the HbA1c is a little on the higher end, but still not diabetic, but what we call pre-diabetic or at increased risk of having diabetes, then you want to do that at least every 3 months, every 6 months. But of course, if you're checking them, there should be changes that you're making in your lifestyle between each check, because then it will either remain the same or keep going up. So
Exactly.
you have to make these changes so that you see it coming downwards.
Yeah. Yeah. Oh well, thank you for that. Those are a lot of checks. Are most of them blood tests or
Yes. So most
okay.
of them are blood tests, but it normally needs just one stick, and we take enough sample to run every single test that I just said. Here at
Right.
the clinic, most of our tests are done in office, so
Okay,
you don't
great.
have to kind of wait that time. Those 2 days, you kind of forget about what you even tested. It may be difficult to come back to the doctor. You're
Uh,
racking your brain. Oh my goodness, what could this be? Usually
right.
within the visit, you're there talking to me, and the nurse takes the blood, runs the sample, brings it back even before you leave the office. So that anxiety kind of is alleviated before you have to go.
I love that. I love that. So I was ending off now. Are there any new or upcoming treatments at Harley Street that you find particularly exciting?
How much time do you have? There's so much. There's so much. Okay, let me do my favorite two, I would say.
Okay, okay,
So the first one is our IV therapy. So we worked very closely with a pharmaceutical company in United Kingdom. and we have specifically formulated these IV therapies that are so different to the ones that we typically have on the market. So everyone doing IV therapy is typically to replace vitamins, but there are other wonderful ingredients that we need to have in the body. Ingredients that our body already makes, but as we get older, it doesn't one, it doesn't make as much, and it's not as effective. Things like glutathione is a wonderful antioxidant that we have currently, and it's new, but we have it now. That we incorporate into our IV therapies. NAD treatment, that's one of the ones that's so trendy overseas now. Um, all these celebrities, all the Hollywood stars does it, and they kind of call it the anti-aging IV. It decreases free radicals, and what free radicals do is they make you age. So
Ooh.
it
When we
reverses
when
that free radical
y'all
damage.
started this already?
Yes, we have. It's new, but we're started. Yeah.
Okay, all right. Well, I say
And we
God make
have a
a visit
whole
down there,
list. We have like a little menu of IV therapy, so you could go and
like a little
see like which
cocktails.
one. Yeah, and
Yeah.
it's so cute. So it's like a little menu, and you can choose which one you want. But of course,
Right.
like I said, even though you come choosing what you want, we always start with one, a blood test, so we know what you're deficient in and what we need to work on, and then we kind of formulate what we think together. It's always a collaborative effort. So we need to know what your lifestyle is, what you hope to accomplish, what the goals are, and then we come up with a specific formulation and we choose the best formulation for you. So that's one new exciting thing that we're doing here. The other one is our weight loss program. So currently we are using, there's a medication called Wegovy, and it's similar to the Ozempic. Have you ever heard of Ozempic?
Oh, for sure,
Yeah.
for
So
sure.
we
I've heard
have
of
the sister
Ozempic.
drug. It's the
Okay.
same, it's made by the same manufacturers, but Wegovy is FDA approved for weight loss, chronic weight loss, whereas the Ozempic is only FDA approved for diabetes management. So we've taken the Wegovy,
Huh.
yes. So
I
we've
did
had
not
that
know
for a
that.
while. Yeah, we've
I
had
just
that
heard
for a
about people
while.
taking Ozempic just to lose weight. Like that's
Yeah.
all I heard about, not to
But it's not
manage diabetes.
actually FDA approved for that. It's to manage diabetes. So you're taking that drug away from persons that actually need that medication. But the company has made a sister drug to it, which is called Wegovy, and that's the one that we use here. But we have a newer drug. There's a newer drug on the market, and they have found that where the Wegovy and the Ozempic, you lose about 15% of your body fat. Um, in about 5 months, which is the time it takes for you to get to the maintenance phase. Again, people don't have to go on it for 5 months, but that's just what the studies have shown, that within about 5 months, persons have lose about 15% of their body fat. But with this newer medication that has come out called Trizapatide, or Monjaro is the brand name of it, they're losing up to 20%. So it works a lot better. The side effects are not as daunting, I would say.
I
So
feel like we need a
it's,
whole nother discussion for this because the
yes,
side
it's,
effects for the weight, and you
it can,
said daunting.
the thing is, the Wegovy side effects can be unpleasant if you take it wrong. If
Okay,
you're just treating yourself, or if you are using it for an inappropriate way, or you're misusing it, I should say.
okay,
The way
okay.
that we do it here, we use it, one, there's a criteria that you have to meet to be able to be on these medications. We always start with blood tests so that we make sure that we are actually treating what we're supposed to treat. Because if there's an underlying condition for weight gain or for weight loss, then we treat that instead of
Right.
doing this medication. And the second thing, there's a step up process. So if you're on the wrong dose at the wrong time, then you get the side effects. If you are being treated appropriately, then there's little to no side effects.
Okay. Okay. Well, that sounds a little bit better then because I was like, wait, what? Daunting side effects.
But it's known to have these side effects. It's
Okay.
known. So people are aware that there are the risk of having these side effects. But the way that we do it here, it never really happens. But with this medication, but in clinical trials, they found that these side effects were even less than what was happening with the Wegovy and the Ozempic.
Okay. Okay. All right. I like those two, and you said there are more, so we can go to a part two clearly. We can do a part two clearly because I do have questions about, yes, the so-called side effects for these weight loss drugs, and then even questions about um, if they, because there was a conversation that I had with another health professional, and they were saying that either they remove certain things that we need, or affect certain things that we need, or put something in the body that might be harmful. You know how it is. But it is good to find out exactly everything about any drug that you're putting into your body.
It's so our body makes the same hormone that we are injecting. Just that particular hormone, which is called the GLP-1 hormone, that only lasts for a really short time. And what that hormone does to our body is it tells us that we're satisfied or that we're full. So if we miss that cue, if we're watching the phone, watching TV at a dinner, that cue that says, okay, I'm full, stop eating, it goes very quickly. And then we continue to eat because we're accustomed. We've been told, eat everything off of your plate. So we're accustomed to that. But this medication puts that same hormone in the body, but it allows it to stay for a much longer time.
Okay, so you eat less.
You eat less, yes.
Okay, and that's really what helps you lose weight, because you
That's
eat
what
less.
helps you lose weight. And in eating
Okay,
less, then you would have to choose the right foods to make sure that you're choosing whole foods and not processed foods. So you're not so skimping on vitamins that you need.
right. And eating the KFC. Okay, gotcha. Gotcha. Thank you, Dr. Serrano. This has been a really, really enlightening conversation. I feel like we talked about so many things, which is really good.
Yeah, we did.
We covered a lot of topics: infectious diseases, aesthetic medicine. We talked about
We
motherhood.
sure did. We took off on that turn, but it's something I could talk about. How long do you have? I should ask. I could talk about that forever.
And but it was good to mention, because like you see, and I've been hearing that a lot, that the stress that is coming up with motherhood, and um women now talking about it, because before it's almost like you couldn't say anything because it was embarrassing to think that you would be
Yeah, like you were
struggling.
less than. Yeah,
You were
yeah.
less than a woman, less than a mother. Like, really? What? You have issues? I remember really quickly seeing this clip where this lady took advantage of this night daycare. I don't know if you saw it, but she has a little girl. She checked her little girl into this daycare that operates at night. So apparently up to 12 midnight. And so she posted it. She's like, she needed a little break. And so she checked her into this daycare, and she was talking about how great it was and that kind of thing. She said she was able, I think she went partying or something, but you know how the internet was. Internet was like,
Probably
oh my
chastised. Oh
gosh.
my goodness.
So they just, oh well, like, how dare you, if you shouldn't have a child, if you know what I mean? Like, they really tore her apart. And I was like,
That's so
the fact
unfortunate.
that there's a nighttime daycare means that there,
There's
people
a
want it.
Yeah,
There's a
there's a
need
need
for it.
for it. There
You
is.
rather
And
she
not
leave the
everybody
child
has
home,
support.
you rather she neglect the child. Like, the fact that there was a service there, and that she was like, well, I need a break, and this will work out
Yes.
for me. And she took the break, and she
That's
just
so
recorded it
unfortunate.
once. Yes. And so, like, yeah, the whole entire internet was like, oh, bad
Yeah,
mom. So yeah, but
that's
I'm
so
glad that we were
unfortunate.
able to dissect some information, and I'm glad that you also mentioned therapy. There was one of the conversations we had, was like, yes, there's
Yes,
nothing wrong with getting therapy.
there is
If you
nothing
need
wrong
it,
with it.
just get it. You
Yes.
could do that. It's
Even
good
if
for
you don't
you.
think you need it,
Yes,
just still talk to somebody.
yes, please,
Yes.
yes, please. But thank you for joining me on this
Thank you for
episode.
having me.
Thank you for joining us on another Wellness and Growth Journeys podcast. Now, if you're inspired to elevate your health and wellness business, the Wellness Growth Agency is here to guide you. We specialize in tailored digital marketing strategies to enhance your client engagement, grow your practice, and improve overall satisfaction. Let's unlock the potential of your business together. Visit us at wellnessgrowthagency.com to learn more. And don't forget to subscribe to our podcast for more insightful episodes. Until next time, keep thriving, and remember, wellness is a journey. Growth is the destination.